In today's mental health check, deciding to go to therapy can be a big decision, right? And a huge first step.
And choosing which kind of therapy is the right fit for you can be just as important, but the choices can be daunting.
That's why today we wanted to kind of walk through the options out there, some of them anyway, and talk about the key questions to ask before you schedule that first appointment.
So joining us now is psychotherapist Robi Ludwig. Robi, a lot of people might think therapy is one size fits all, but that's really not the case. So what questions should we be asking ourselves if we're considering diving in?
The easiest thing, what do I want to work on? Do I want to work on adjusting to a situation, to improving myself, to resolving trauma, to making a connection between my body and my psyche, to deal with old trauma? So really ask yourself that. What do I want to work on? And then what kind of therapy would really help me do that? Is it talk therapy? Is it something that deals, with alternative types of therapy that aren't so talk focused?
Right.
And also who, male, female, culturally sensitive, are good questions to ask.
I think the most common, I was looking it up, the most common type of talk therapy is cognitive behavioral therapy, right?
Yes.
Some people call it CBT. Can you walk us through what that focuses on and who that might appeal to?
Yeah, so someone who likes to talk, it's great for. Someone who might be interested in brief therapy. So we all have these cognitions in our head, the stories we tell ourselves, which may not be accurate and cause us depression, anxiety, get us to catastrophize. And this type of therapy helps you look at your thoughts, poke holes in the thoughts that are not accurate, and it does help to relieve anxiety. There are tools you can use, there are homework assignments. Many people like that aspect of it.
And not all therapy is talk heavy. I'm thinking of EMDR.
That's
Can you walk us through that acronym and what it entails?
So EMDR is for somebody who has trauma that they can't resolve. Sometimes it's PTSD. It's a rapid eye movement and sometimes tapping that helps the right hemisphere of the brain connect with the left hemisphere. And what it does is it puts your traumatic memories in its proper place so it's less disruptive. We don't know exactly how it works, but it's been highly effective even for people in talk therapy who might not be able to get to the deeper issue.
It's something a practitioner leads you through.
Yeah, well, both are, but it's just a different style and different focus.
Different approach. There's also something that people call somatic therapy, which focuses, I think, on the body in addition to the mind. Is that right?
Right. So think about people who have a lot of symptoms, get sick, have a pain in the neck or in the back. Sometimes you want to check with the doctor. It's not medical. You don't want to analyze a medical condition. Get, medical clearance. And then some people are disconnected from their body and their mind. And so this helps a person connect their emotions to different disorders or traumas they're feeling in the body through poses or certain movements, breathing. And for the person that wants to be more in sync with themselves, it's very helpful.
Even through talking, I stumbled upon a somatic therapist and she would ask, where do you feel that emotion? I was like, I don't know. So it helps with some mindfulness.
That's right.
Too. Can you walk us through internal family systems therapy too?
Yes. So we look at our brain in terms of the person in our brain that's critical, the one that's telling us we're not good enough, the part of our brain that might be resistant to moving forward or self-destructive. And we kind of make peace with that drama. And all different aspects of ourselves can talk, find more harmony, and then you can be less troubled as you make decisions in your life.
That's the idea behind internal family systems.
That's right. And sometimes we internalize family members that we have difficulty with. So it's really helpful for that.
Robi Ludwig. Yeah, Robi Ludwig, thank you so much.
Thank you.
Thank you.